Why is contrast used in a TB court scan? Imagine trying to see the fine details of a complex puzzle without all the pieces clearly visible. That's similar to what a court scan does for doctors trying to find tuberculosis in the body. When tuberculosis affects the lungs or other organs, it can create lesions, cavities, or areas of inflammation that are sometimes hard to distinguish from other diseases. This is where contrast comes into play. Contrast agents, usually made with iodine, are injected into the bloodstream to make these areas stand out more clearly on the scan. They help highlight blood vessels and show how tissues are supplied with blood, which is very useful because active tuberculosis often causes increased blood flow to the affected areas. Using contrast in a tuberculosis court scan improves the ability to tell TB lesions apart from other infections or even tumors. For example, if a lung nodule shows up on a scan, contrast helps determine if it's a granuloma caused by TB or something else like a cancer. This distinction is crucial because TB needs specific antibiotic treatment, while other conditions might require different approaches. Studies have shown that scans with contrast provide more accurate and confident diagnoses, leading to better treatment decisions. Contrast also helps reveal how active the disease is by showing which areas are inflamed or highly vascularized. This can help doctors see how severe the infection is, monitor how well treatment is working, or spot complications like abscesses or enlarged lymph nodes. Sometimes, chest X-rays do not give enough detail, especially if the images are unclear or normal but suspicion remains high. In these cases, contrast-enhanced court scans can provide more specific features such as cavities, patterns of spread within the airways, or fluid buildup around the lungs. In cases of extrapulmonary tuberculosis, which affects organs like the lymph nodes, intestines, or kidneys, contrast helps define the extent of the disease. It highlights abnormal tissue changes, guiding doctors in deciding whether a biopsy or drainage might be needed. While contrast agents significantly improve the accuracy of imaging, they are used carefully because they can pose risks, especially for people with kidney problems. Overall, contrast in a TB court scan makes the images clearer and more detailed. It helps doctors differentiate tuberculosis from other diseases, assess how active and widespread the infection is, and plan the best treatment. Remember, every patient is different, so healthcare providers always weigh the benefits and risks before using contrast. If you or someone you know is undergoing a TB scan, it's important to discuss any concerns with your doctor and follow their advice for the safest and most effective diagnosis.